Chronic pain is something that a lot of people can relate to. It impacts 1/3 of Americans at a cost of more than $500 billion per year. Our next guest says he is the first Connecticut doctor to successfully treat chronic pain with a revolutionary new therapy that doesn't involve drugs or surgery. Dr. C. Evers Whyte joins us now. Hi, doctor. How are you?
Hi, Teresa. How are you?
I'm good, thanks. Tell us a little bit about your background.
Well, I've been in Connecticut, in Greenwich and Stamford for 14 years, and focusing primarily on chronic pain syndromes. And I'm very excited to talk today about a new therapy that that can really help to treat these chronic pain patients, as you just said, which is a huge problem.
About how big of a problem? I mean, I guess we saw that it affects 1/3 of Americans.
Yes.
How do you define it exactly?
Well, chronic pain really can be divided into two categories.
Okay.
You have the mechanical type, arthritis as an example, and we treat that differently than what we're going to talk about today. The other type of chronic pain, which we found recently to be a big problem, is a type of pain where the nerves become overexcited after an injury.
Okay.
So these pain nerves won't shut off. Usually what happens is there's a dialogue between the nervous system and the brain after an injury.
Okay.
So the information comes to the brain, and after the injury's healed, that should signal the brain to calm everything down.
That's what we're looking at on the screen right now, correct?
Yes. So if you look at this is a sciatic nerve problem, and something like this is typically caused by a disc herniation in the low back. A lot of people can relate to sciatica. And in the cases of a herniated disc, that person would, let's say, have surgery. They would perform a discectomy, and the pain should go away. But again, in some cases, the nervous system, in a sense, short circuits.
Okay.
And that pain gets worse and worse. The brain doesn't get the signal to calm down. And so that then becomes what we call a neuropathy. And what we're going to talk about today is this new treatment that will actually work directly on the nerves to calm down that neuropathy.
Well, let's talk about it.
Sure.
It's called Calmar.
Calmair. Yep, it's Calmair pain therapy. And you want me to tell you how it works?
Yes, please. That'd be fabulous.
All right. So it sends a no pain message through the skin.
Okay.
And goes up from the nervous system to the brain and teaches the brain by sending a no pain message to adapt to this no pain state, and it gradually calms the nerve down. So we use surface electrodes like an EKG electrode.
Okay.
And send this unique signal through the skin into the nervous system itself. And over time, typically 10 to 12 treatments, the nervous system will calm down. It also stimulates new neurons to develop in the brain, which hold this no pain state.
So it doesn't come back then?
In 50% of the cases, the pain will gradually come back, in which case we will provide booster treatments, if you will, and bring the pain down to a manageable level again. But in 50% of the cases, the pain doesn't return, so it's a cure.
And does it treat a variety of conditions?
It does. It treats nerve injury specifically. So a common nerve injury that we have, which is a complication of diabetes, is called diabetic neuropathy. And in a case like this, there's damage to the nerves because of poor circulation and too much sugar in the blood. And the burning and tingling and numbness kind of pain starts in the feet usually, can affect any organ, but this can bring that down. Another example, like that other slide where there was the sciatic nerve.
Sure.
In certain cases, actually in many more cases than we originally thought, after surgery, that nerve won't calm down. It will stay, in a sense, overexcited. And so post-surgical neuropathy is pain after surgery. And it works very well with that. Another nerve injury occurs in some cases of chemotherapy. Sure. So that's a chemical injury. The chemotherapy drugs actually will overexcite the nerves or damage the nerves. And we call that chemotherapy-induced peripheral neuropathy, or CIPN. And the Calmair works beautifully with that.
How do you determine if someone is eligible, if they're a good candidate for this?
Well, Typically, they'll call our office, and we have a screening process on the telephone, and we'll determine whether this person is a good candidate for a Calm Air treatment. We invite them in, and we'll actually do a free trial and consultation to see whether they respond.
Great.
And if the person responds, then we discuss going forward and how many treatments we think it's going to take. And we want to make sure that we can help these people before they start treatment.
And you said about a 50% success rate?
Actually, it's about an 80% success rate. Yeah. So if it's neuropathic pain, right, which is a specific kind of pain, we have had about an 80% success rate treating these patients. And what's amazing with this is that it doesn't have any side effects, and it doesn't require drugs. You know, there are a lot of drugs that are used to treat chronic pain that have very powerful side effects.
Okay.
And they can become addictive. You know,
Sure.
these narcotic drugs, the neuroleptic drugs, have other side effects, dizziness and poor balance. And a lot of these people will get this breakthrough pain where the drug only works for a certain amount of time,
Sure.
and then they have to up the dose. So the beautiful thing about Calm Air is that it doesn't have any side effects, it's not invasive, and we know usually right away during the test treatment if it's going to work.
Very good. We have some before and after pictures. If
That's
we could
great.
take a look at for us.
So if you look at the slide on the left, the picture on the left, this is a young woman who sprained her ankle. And if you notice the color in the foot, she developed a pain syndrome called RSD, or reflex sympathetic dystrophy. And in a sense, the whole nervous system short-circuited. So her foot actually was not able to put any weight on it. The skin becomes so sensitive that when you touch it, it doesn't feel like just a brush of your fingers. It actually felt like a blowtorch for her.
Oh my goodness. Wow.
This young woman was only 18 years old. She did this playing sports. So with the Calm Air therapy, we returned her back to a normal foot. She's actually now playing junior Olympic volleyball.
Oh, so that's a great success
Yeah,
story.
it's
All right,
fantastic.
Doctor, you offer free consultation.
Yep.
And a free trial. That's
Yes.
correct. Very
Yep.
good. Let's put some information up on the screen. The New England Center for Chronic Pain is located in Stamford. You can call 203-599-4848 or visit neccp.com for more information. That's great, Doctor. Thanks so much for being here.
Thank you, Teresa. Thanks
All
a
right.
lot.
Up next, we're heading into the kitchen. Chef Barbara shows us how to make a dazzling holiday dessert when style returns. Don't go anywhere.